Okay, so, oh, yeah. Okay, so this is continuing where we left off last week, guys. Let me see if I can,
Can I ask you a question? I looked at the syllabus, and it said we have a midterm on the 18th.
yes.
Are you gonna be reviewing for that next week? Or is there any way we could put that off a week?
So it's the 18th of
So that would mean we have to,
February, right?
yeah, so that means we'd have to review next week, right? Yeah, because that would be the 11th.
Yeah, you're right.
Yes, ma'am.
Could we please push it off 1 week?
Say again?
Could we please push it 1 week? My husband has surgery on the 15th, so I don't know if I'll be here
And
on the
my dad has surgery on the
18th.
14th,
On the-
so I won't be here.
24th, then it would be? Okay. Where would
Yeah.
next week be?
The following week.
I have surgery on the 20th.
Shit. Oh my god.
Okay,
It's
so
online.
why don't I
Okay.
give you, why don't I give you an at-home test
Okay.
That would be good.
for,
Dang, I don't even see a syllabus. We had a
Pardon?
syllabus?
She sent it, she
She
sent
Send
an
it in
email.
email.
I sent you a syllabus.
It's in our email.
I'd like for that. I don't remember seeing it.
See, what I'm worried about is my dad's having surgery on the 14th, which I've got to be there because he gets very aggressive and anesthesia
Yeah.
and,
Okay.
somebody needs to be there for that.
Research for syllabi.
And, so I won't be in clinical that day. And then I won't be in your class on the Friday because I got to go up to South Carolina, take my mom to a neurological. So I'm just, I was just.
So why don't, what's the next week? What is the
Next week's the
week?
25th. That's
That's
Friday.
the Friday.
Yeah.
But she has surgery.
She has
No,
surgery.
I'm
But if you're doing a home one,
getting there. What if I say, okay, I'll give you an open book test to do at home for the week of what's the Monday of that week?
21st.
21st, the week of the 21st.
Yeah, that would be good.
So you
Yep.
can do it throughout the week. How does that sound?
And so would that mean your review would be on the 18th? Because that's the Friday before. Are you planning to review?
It will be in here.
Oh, so there'd be no review, so it's just an open book. Okay, that works for me.
And they'll be
Perfect.
taken from this one.
That's perfect.
I had to change my password and I never logged back in. That's what
Okay.
happened.
Okay.
Thank you for
So-
that.
Can we get started now?
Yes, thank you, I'm sorry.
Okay, so let me see if I can get this a little bit, okay. No, I can't do it that way, so, okay. So, Steph, if you wanna move forward so you can see better, or are you quite happy to sit here?
I'm gonna sit back here.
Okay,
Back of the
that's
room.
fine. Okay, so here is the one that we left off. Okay, your patient has been under treatment for 1 week and has had to have an indwelling catheter port surgically placed. Since the surgery, he has not been able to lift his arm to fit into the immobilization device. The therapist should, and the answers for those of us at the back, leave the arm down and set up using anterior markings, lift the arm as much as possible and set up as usual. Find a comfortable position for the arm and re-simulate, and put both arms down and remark the patient.
C seems the best.
Pardon? C, Charlie. Yes? Everybody agree? Yeah, okay. Yeah. Yeah, I mean, if the patient has his arms up or arm up and it can't do that anymore, you can't just put the arm down and treat as normal, because why?
You messed it up.
The anatomy's all gone on to hell, right? So you cannot do the anatomy. You cannot play with the anatomy. Okay. The operator's console should show all of the following except. So what's the odd one out? What doesn't it show?
D as in dog.
Say again?
D as in dog.
D as in Delta.
Delta.
Yeah. Everybody agree with that? Okay. Yeah, well, that makes sense, doesn't it? Okay, when treating the floor of mouth, the bite block may be used to, and this is one of these, does she have any hands?
No. She has no hand.
Hey,
Bribery and corruption here.
yes. That's my main goal in life.
Goal.
That's my main goal.
Thank you.
I wanted you to get your points but not spend your money, so.
Oh, well, you could have spent my money. Thanks.
This is for you.
Oh, yeah, all of it? Yeah, sure. Back there. Back there. Let me go and see if I can still find my, paper towels. Think about that one before, while we're there.
We got it.
That's the one that we keep.
I don't understand why
But you know what,
they
every time
keep
we come
giving
back to
that
it again, I'm
question.
like, I still don't
this
really
one?
know what it
Yeah.
is. 'Cause
Is that,
It's C.
Sure, it'll help, man.
is it a
it could be
headache?
C,
Yeah.
yeah, I think she says it's C, but I thought A, because the palate,
Oh,
yeah, but the palate
I
just
remember
moved.
because it was something that I was
Yeah, I
like,
know.
no,
But it
like,
could be to push it,
yeah.
it could be to push the top, yeah, upper palate away.
Okay, but your upper palate doesn't move.
Okay.
Well,
When you open your mouth,
But when
it's-
you open, but when you open your mouth, it moves it lower. See what I'm saying? It moves this part, but it keeps this part out of the way. You see what I'm saying? It increases the distance.
Okay, so
Wow, there's very few of us in here today.
So I can see how that would
What?
be it. But this is the one we keep coming back to, that every time we come back to it,
It's a different,
I
yeah,
get confused.
that's right. So, let's see. Treating floor of mouth.
When you're late,
So floor of mouth, yeah.
bribery and
No.
corruption, she said.
This may not agree with what I'm gonna say the answer. But my thoughts would be, so what's everybody else's thoughts?
I think last time we said it was C, right? You press and move the tongue into the treatment field.
Depress and move the tongue into the treatment field. So why would you want to do that?
Well, you said that usually when you treat the floor of the mouth, you usually have to treat the tongue as well.
So is there anything else that you could do? Project and move the teeth away from the treatment field, Bob? So, do that. If you put the, it's not really gonna move the teeth away, it's gonna move the upper jaw away a little bit, but it's not gonna bend the lower teeth. Let's see what it says. So I think I'm gonna put C. Correct. Correct answer is A, move the palate away from the treatment field.
It should say upper palate, because when you open your
Yeah.
mouth, it is moving your lower palate away so that it's creating a distance between the upper and lower, so you can
Yeah, so
actually
it
get
is.
the bottom.
Yeah, but the
Feel
lower
better.
palate is where you wanna treat if you're
Right.
treating floor mouth.
All right, so it's
So it
moving
should
the
be
upper,
the upper palate.
it's moving the
yeah.
upper palate further away from the treatment field.
So my thoughts would be,
It's okay, it'll buff out
you
eventually.
should give you two answers on that one,
So one day it doesn't.
A and C. If you're moving the tongue down, you move the palate up.
So just remember, if that is one of our midterm questions.
No, it won't be.
Can't wait to get this on the boards. I know we will. All of us will get this one
Okay.
question. We're gonna be like, of course.
Which of the following does not improve the therapeutic ratio? single field, multiple field, fractionation, combined mortalities. What? What looks like, excuse me, what looks like the odd one out here?
Fractionation. I don't know what's combined modalities, like,
Isn't that like,
You may use photon electron.
I think it's fractionation.
Anybody want
I'm
to
just guessing.
second guess that? Fractionation. That's why I give you the choice.
So what does it say?
The therapeutic ratio is improved by using multiple fields, fractionating dosage, and combining modalities to keep delivered doses low. Single field, you can't do that. Before starting treatment of a boost field, I've had this one before, it is best to take verification course because
D.
Yeah.
D. Delta.
D, delta. Okay. Yep. The linear scales on the treatment table are useful as an aid to
A.
know what we're talking about when we say linear scales, right? No,
Are we talking about like the markings?
there's markings, there's numbers on the bed all the way down the sides.
Yeah,
What are you used for?
I would say
Pardon? A.
Alpha. We have a doctor. I have a funny story.
A. Okay, do I need to pause it?
And you might know this.
Ages tales of clinical.
It's about you guys don't have stuff like this happening
I feel like I do, and then I just.
Yeah.
So tell
It's
me
so
something,
interesting to me.
Have any of the therapists reported this to their boss?
I don't know.
No.
No, like I haven't even had an orientation with the boss. He told me that he was going to do.
it'll come 2 weeks later.
He was like, "All right, get with like we'll get with each other in like a few days or whatever." And I was like, "It's
Yeah.
been 2 weeks."
Yeah.
I'm not worried about it because I'm fine. Like they know, like the
Yeah.
CT people know when I come in, when I have to leave to get
Yeah.
Aubrey and stuff, so they're fine with it and stuff. But like,
Yeah.
he was just like, "Yeah, stay with Kristen and you'll be fine." And I was like, "Okay, that's fine."
Okay, that's good.
Yeah.
I only have 2 more CT comps left, so she was like, "You can finish them next week and figure out what the
You've
next
got
step
all
is."
your treatment comps.
I just have an abdomen, but she was like, "We might not get that because it's
That's okay. We can do that in
Yeah.
class later.
okay." But
Okay, let's get back to
Craziness.
what we're supposed to do. Areas in the head and neck. The most reproducible position is.
Supine.
B.
Supine.
I don't think she heard you.
Okay. What are lateral recumbent and semi-recumbent?
Recumbent, isn't that? That's
I
not
don't know.
like
There's not a lot.
at
about
an
this
angle,
one.
right?
No. It's
Fowler's. That's Fowler's, isn't it? Where you're like sitting up partially at an angle. Okay, never mind. I don't
Semi-recumbent
remember.
is more like Fowler's, where you're sort of, it's what they call the recovery position in CPR.
Yeah.
You know, you're lying sort of like that.
Oh, okay.
That is semi-recumbent.
Oh, okay.
Or you can lie sort of like this, half on your side.
Okay.
So, and recumbent is just basically right on your side with your knees
What's
bent.
lateral recumbent?
Lateral recumbent is right on your, lying on your side with
Okay.
your knees up.
Okay. And what's semi?
Semi-recumbent is half on your side, sort of lying sort of like that.
Okay.
Obviously the legs go up too. Okay, so we're doing supine. And both of these are not really reproducible. Your patient, oh, here we go again. Oh no, your patient is being treated to the oral cavity. They may complain of.
Radioactive fillings. My fillings are radioactive.
What did they complain of?
C.
Sharp.
C, sore mouth and gums. Okay. Radioactive fillings, I like that one. Yeah. So sore teeth, probably sore gums, not teeth itself, but I don't. Okay, regional lymph nodes for carcinoma of the prostate include all but one of the following. So, lymph nodes,
Epigastric.
epigastric.
All but epigastric.
Everybody agree with epigastric? Yeah? Okay. Yep. Principal reason for tattooing. Principal reason for tattooing, not fact that.
C.
B, C?
C.
C, Charlie? Everybody agree with that? Okay. Yeah. Skin tattooing is performed so that there's a hard to remove marker to be used for daily alignment. Now, that doesn't mean to say that it's always on the ISA center, but at least there's an alignment. And then you may have to move for the ISA center, right? E. For portal verification, bone tissue contrast is better using a kilovoltage imager rather than a megavoltage imager due to the absence of
Sorry. Excuse me.
I'm gonna split you two up if you're not careful.
I had to sneeze.
It was a funny sneeze. Did
I
you
was
hear
Hold
it?
it in so I didn't spew everywhere.
Yeah, okay.
You missed a great sneeze.
Okay, which one?
I don't know. I didn't read it.
Christina, say this. Oh, so that's what MD stands for.
Megavoltage?
Oh my
Yeah,
god.
Wow.
Ciao.
I'm back here too.
Say A.
I would say sound.
A. A because photoelectric means that's like the fuzziness. So A.
Okay,
Because,
or lack of sun.
or D.
Okay, let's see. Yeah. Bone contrast is better in TV imaging
Bro,
due
you don't
to
know
the
what fucking MV stands for.
absence of photoelectric interactions in the megavoltage beam. So it's actually the lack of photoelectric absorptions rather than the photoelectric absorptions.
Okay, okay, I'm confused a
Say
little bit,
again.
because it says, so for portal verification, bone tissue, so portal I always assumed was MV.
No, you can use, the only problem with doing KV portals, you can do, if you have, say, an AP chest that you're treating, right? And you want to check position relative to the ribs, it would be easier to do KV images because you can see the ribs. The only problem with KV imaging is that you don't get MLC. To get MLC, you need MV imaging. So you can do a lateral or an oblique, but you won't get the MLC in it. So you can't use portal, you cannot use KV imaging for actual portal images.
So that's what I'm confused by.
Okay, so if you want to know if the treatment port is in the right place anatomically, you can do a KV image. But that won't suffice as far as a portal verification, or, excuse me, I'm using the wrong phrase, but a portal image that you're going to show the doctor that will need MV.
So isn't that what that is, a portal verification is one that the doctor gets?
No, the portal images is the one that the doctors get, and they need the MLC in it.
Okay.
So the MLC, you have to do MV images. KV images would be just to check if you're in the right place before you do the portal image. If, for example, patient lost his marks and you want to do a film, just a normal film to check position, then the KV images would work, because then you can look and see the ribs and see the sternum and see where you need to be. And then you would do the MV portal image.
Because we're doing a patient, we're doing her thigh, femur, and they do an upper thigh and a lower thigh with MV every time she comes in.
Right?
And so like they've got her, really kind of got it all
Yeah.
drawn out on her leg, but they don't do a
Cone beam.
cone beam.
No. And you're asking why?
Yeah, I mean,
Well, the cone beam, CBCT, or the cone beam CT, is supposed to be used for soft tissue. If you're doing a thigh, you're doing the bone, you're treating the bone. The cone beam CT wouldn't do any good, because,
and she's also at an extended distance.
and that's the other reason why they're not gonna do a cone beam. Because the cone beam CT would hit.
The thing, okay.
So that's one reason. Well, and yeah. So if you're doing basically a whole femur is what
So-
she's doing, pretty close,
The whole thing.
on 2 fields or 1 field.
One field extended
Extended
distance.
distance. Okay. So if you try to do extended distance in a KV, a cone beam CT, it hit. You'd have to bring it up, do the cone beam CT, and then bring it down, which defeats the purpose of the cone beam CT.
So basically what they do is they do lateral and they're in and out, and then they do SSD, and then they make sure, and then they do the
The
MV.
MV.
Yeah, it's very interesting to see how they do it.
Yeah,
They can get right on that.
Oh, yeah.
No, but I just didn't understand why
Yeah.
they, why they chose not to do a CBCT.
that's why. 2 reasons. One, it's an extended SSD and it's physically impossible to do it on beam CT. The other reason would be that CBCT is primarily supposed to be for soft tissue. Although you can do bony anatomy on it, it's mainly used for CBCT. So the possibility is, the only reason they're not doing it is because of the extended SSD and it's physically impossible. If you want to keep it correct.
And I always mean to ask them, but that's kind of one where they're very busy.
Right.
Because they're, she's in a lot of pain and they're trying to get her
Yeah, of course.
on and off. And then I forget to ask them after it's,
Oh, that's
we're moving
fine.
on to another
Yeah.
patient.
Yeah,
So,
that's good.
thank you.
Yeah. And that would be, so they're doing APPA, extended
Yes, and
SSD?
so like, after they bring her up, they've gotta go underneath the table and check a different, check their SSD.
So which machine do they
They're
have
using
there?
the Electa.
It's an Electa, okay. So do they have to, when they're bringing it up, what SSD are they going to?
They're doing it 110 for the AP,
Yeah,
and I think it's like 104.5
oh,
for the.
okay, so it wouldn't
PA.
be enough, that's fine, yeah. Because if it's over a certain distance extended, the machine will stop, or the bed will stop, because it doesn't go that high.
Yeah, no, I don't
And
think
then
they
you
have a
have to
problem with
press
that.
a button to
Yeah.
override and move it up.
It must not
So-
be that high, because they don't have to do that.
So it's, we used to do ones at 120.
Yeah.
And we'd have to do that. Okay, dose rate has been increased from 250 MU per minute to 350 MU per minute to administer a large dose for patient with keloids. If you neglect to change the dose rate back, every patient following will receive what?
See.
You're going from 250 MU per minute to 350 MU per minute.
Still CC.
Because they shouldn't get more dose.
What's the answer?
It's just the MUs is on the dosage.
Oh, the dose rate. Yeah.
See.
I think we all agree on C.
C?
Yeah. The jury has decided.
Dose rate in the shorter time or dose in the shorter time? Yeah, that is correct. So you're doing 350 MU per minute instead of 250. So of course, everybody will get a shorter period of time.
I guess you just read closer.
Okay, here's one for the calculators, guys.
Oh no.
If 203 monitor units deliver 180 centigrade, how many monitor units will deliver 250 centigrade?
C as in Charlie.
Pardon?
I think Christina should.
C as
I
in
know,
Charlie.
you're so fast.
C is in Charlie.
Wait, let me do it. I don't trust her. Alright.
Wait, I'm not there yet.
We're okay now?
Where did you get three?
Asia has spoken.
I think I
Okay.
typed something in wrong.
I got
Okay.
the same thing as Christina.
Yep. Me
C for
too.
Charlie?
Well, Natalie got 36,000, so.
I wasn't. I was going so fast.
So cross multiply.
I didn't get there
by direct
yet.
proportion. Yeah.
See, look, I was doing it right. Hold
I
on.
just did trial and error. I did
Yeah, see?
203
You-
divided by 180 and got 1.12. So I did, I started with 300 divided by 250 and got 1 point something, but it wasn't 1.12. But then when I did 282 divided by 250, I got 1.12. So I got the same ratio.
Okay.
I have no idea what you just said.
I understood.
Like
Okay.
if you divide
Okay, at least someone did.
203 by 180, you get like a distance. So then you would want to get that same, not distance. You would want to get that same number.
Said, since I'm gonna let you away early today,
Oh yeah, we need a break.
yeah, since,
My brain hurts.
yeah, your brain hurts already?
Hmm.
Is it Asia just coming in?
I think so, yeah.
You wish.
So
She
I'll see
really
you back
just-
here, guys, in 20 minutes.
Really just did too much, you know?
I'm just watch.
Too
I'll show
short
you.
of a time.
You see that? Literally clean, right? It's a fucking crayon.
Ladies, put your phones down.
Yes.
So, what's the answer?
Would not cause prostate movement.
Respiration.
I already said my answer.
I know, just wait until the other group has got time in between their chats here.
Hey,
No, wasn't it?
So do you agree
what is cecum
with
again?
It was A, right? No, it was D.
respiration?
That's
What
right.
is cecum again?
We got this question last week. It was D. It's D.
You're asking what cecum is?
Yeah, what is that again?
Somebody tell her what cecum is?
Part of
It's
the
part of your-
colon.
It's
Part
part
of the
of
ascending
the
colon.
Yeah.
But you know,
Oh,
I
really
spent
bad?
all week after this was one of the questions we had last week. And I spent all week trying to find cecum.
Oh, I do
Um,
remember that.
Cecum location, with respect to prostate, because I was thinking like even, so you got, it would be like over here somewhere, right? But I would think, and then I looked at the volume of the cecum is like way more than the rest of the colon as far as like it's got, it holds
Yeah.
more.
So you
So I
basically
would think-
have the rectum, and then the colon,
What is
so the
respiration?
ascending colon,
Transverse.
transverse, and descending colon, and the
Sigmoid.
cecum is basically there.
The ending of it, right?
Oh, I thought the cecum was right before the ascending colon. Am I wrong? Maybe that was my problem. I thought it was,
The cone.
it went, that juncture between the small intestine.
Intestine and the large intestine?
Yeah, it was right there, I thought. Am I wrong?
I think it was toward the end.
Okay,
Let me look it up.
I thought it might have been toward the
Another
end.
I have a few books now.
Let's see.
Oh no, maybe.
Let's see, hang on a minute, I'm just gonna minimize this.
You're correct.
Yep, you are right.
Right.
Cecum, a pouch connected to the junction of the small and large intestines.
Okay, I was wrong.
Okay, so but my question
So
still
my,
stands.
my thought
I
process
was trying
the
to
same.
find
that-
I was trying to find anything that showed me the location of the cecum
In,
with respect to the
comparison-
prostate.
In comparison to
And I
prostate,
couldn't find anything to show me like where's the prostate in compared to where, because
Because isn't
I
that
would have thought that would also, if it were full, it would also push down a little bit and so.
not
So
necessarily.
you're saying of all of those choices, that would be the furthest one that would, so that would be.
Well, no, I'm not saying that.
Definitely, I
because
think respiration would change it.
respiration
rectal volume would
probably
definitely
not,
change it.
No, the cecum
Oh.
volume may change it, but it depends on
Here I am thinking, how would respiration change it? Like,
how large a
that's why I
field you're
chose-
doing.
That's why I chose the two.
Oh, fuck. I read it wrong too. Good one.
Because the question is, which of the factors would not cause prostate movement?
Right.
And pretty much everything
So
causes
anywhere
prostate
in the
movement,
gut,
so.
depending on whether it's full or empty, could alter the prostate.
Yeah,
that
I
would
don't
be
like this
cecum
question.
as well, right?
Stop.
Possibility.
Well, that's why they ask you to come with a full bladder and empty rectum.
But that's not cecum.
Yeah, that's not gonna empty out, yeah, it's not gonna empty. your-
Yeah. What would not cause prostate movement? Hold on, I'm just,
So everything
confused.
will but one.
everything will except,
Maybe the
Okay.
cecum is always full.
I mean, if you're
I
starving.
mean, because, yeah, unless you're starving.
Yeah.
Because it's so
Yeah.
far, I mean, it's
Yeah,
just,
because that's
it's the
basically
first
what
stop
this-
after the small intestine.
small intestine
Yeah.
does.
So maybe it wouldn't because it always stays.
Okay,
It
so
would
are
be
we
A.
saying
It would-
respiration?
No, I think the answer was D.
It was D.
It
I
was.
That's
remember
why,
that.
that's why I was looking it up, because they said the
Okay.
answer was D.
I would think respiration, but.
So motion of the prostate gland can be influenced by respiration, position changes, rectal volume, and sometimes bladder volume. So cecum volume. Well, let's just see here. Wait 1 minute.
Is like the
I don't
cecum
understand
too,
that.
like,
Yeah.
Because your diaphragm
Push
is
it,
your
so yeah, so
thoracic
it's gonna
cavity,
move.
Mhm.
and that's where your respiration is.
yeah,
not-
so why would, you're not like,
Yeah, but
you're
when,
not like
when
gut
the
breathing?
diaphragm goes down, it really kind of pushes everything. You see what I'm saying? So everything gets shifted a little bit every time.
If you're like correctly breathing, I guess,
When you
like,
breathe out and that diaphragm gets pushed down, right? Yeah, because you're,
like you're, like we're trying to figure it out on ourselves, like,
Yeah.
Mhm.
let's see if I feel that pressure.
the pressure on our prostate, guys.
Yeah, that would work.
I was really doing that at home when I was trying to figure out.
I don't feel it.
Maybe because like when you breathe, like your
Okay, so I see
whole
the cecum.
abdomen moves. You
I'm
know?
lightheaded from trying to breathe in.
So there's the cecum,
Okay, so where is the prostate?
here somewhere.
Okay, so why would that not be affected by your cecum?
It should,
I know, that's what
yeah,
I
it
said.
should. So the cecum is, yeah.
I
So
just
it's-
know this
it's
is the
here.
question we're all gonna get, and we're gonna be like, "What the fuck?"
Just choose the one that you're like, I
Unless
think
it
this is right,
stays
but it's this
full, so
one,
it
you know?
doesn't change
Well,
volume.
let's see what else to say here. In,
Could ask Laura.
Let's call, I wish I had her number.
Instagram calling.
You can just take a picture of that question and post it.
Yeah,
so
that's
everyone
true.
does.
Okay.
But we want to call her.
And be like,
Be obnoxious.
What
does she not work though?
Yeah, she does, but she does like the book on her weekends. That should
She's
just
gotta
make
have
money.
no freaking spare time.
nah,
Does she
might
have
be
a
in it.
partner? Like,
I don't
a
think-
Yeah,
wife,
she's
does
married.
she?
No kids
You
though.
have
Yeah, I
time
mean, I
for
spent
Yeah, I don't know.
literally
I don't
2
know.
hours trying to find it.
I couldn't. I could not.
Well, like
If
the
I find
prostate
anything, I'll
is
let
like,
you know.
is
Okay,
wouldn't the
thank
prostate be like lower back area, whereas your cecum would be like,
Say again?
wouldn't the prostate be like your lower, not like rear end, but lower back area?
Posterior.
Where, okay. Yeah, posterior as compared to the cecum, so maybe they're in different levels of the
So-
body.
The prostate is actually anterior,
Okay,
relatively.
take a look up, so it looks like.
So the prostate is here.
Okay.
The cecum would be somewhere here.
Okay, that's more closer than respiration though.
But respiration moves everything though.
Well, respiration, if it moves the diaphragm,
It
then
moves
basically
everything.
you could say it moves everything
Rhythmically
else.
moves
I
everything,
guess.
yeah.
I don't like that question next.
I'm just trying not to. Not a good question. That's prostatitis, so. Oh my goodness.
She's sending it to Laura.
I'm gonna complain, I'm gonna send it to the
Oh,
ART or whatever, ASR.
this is not AR.
Mosby.
Oh, damn, I'm gonna send it to Mosby's and be like, what the hell?
Huh?
I'm gonna send it to him. I'll be like, this doesn't make sense.
I don't know. I tried
Okay.
Googling it and nothing came up.
Send it to the author.
I will.
Okay, wedge filters. The wedge filters are most commonly constructed out of
A.
That was my A. While I was yawning.
nobody uses wedge filters anymore, so. A prescription reads 1.2 gray TID to a total dose of 14.4 gray for a total body irradiation case. How many days are required to fill this prescription?
Three, 4, B.
Christina's like, I already have the answer, just sitting here waiting for somebody else to answer.
I was trying to get there first.
Hang on a minute.
Damn.
Yay. How'd you get?
I had to figure out what TID.
So what'd you say?
My brain's not here today.
Wait, so what you, I'm gonna tell you what you would do. You do 1.2.
No, I'm not asking you how you did it. What is the answer? And then you can tell me how you did it.
B as in boy.
4?
Yes.
Yes. So, okay, well,
I
how did
yelled
you do
that
it?
5 minutes ago.
So you would understand that TID means 3 times a day,
Yes.
right? So then you would do, oh, it's telling you up there.
1.2
What?
times
You would do
3,
1.2 times 3,
Yeah.
and then 14.4 divided
And then?
and then 14.4 divided by that answer.
I did 14.4 divided by 1.2, and that gave me the per fraction dose.
No, per fraction is 1.2.
No, it gave the per day dose, right? I think. Hold on.
No.
I don't have
That's
a
how
great answer.
that's how I did
Excuse
it.
me, no, per day would be 3.6. Per fraction is 1.2.
Okay,
Yeah,
so
that's what I said.
14.4 divided by 1.2
Yeah,
gave 12.
no,
And then I divided that by 3 times a day, and I got
That's
4.
right.
I'm the one who said the answer
Yeah, that's
first,
what
so
I
I'm
yeah.
yeah.
So the thing about it is you have to remember that you can't say 200 per day. Because if it's 3 times a day, then it's 600 per day. So you always have to remember to say fraction.
But it's still, the fraction is each time, so it's 3 fractions a day.
That's right.
Right, that's,
Yeah.
okay.
I just remembered. Did you taste
Okay.
the donuts that the patient brought?
So
I
the
stay
chances
far away
of
from
getting a
them.
TID patient is pretty minimal these days. A BID patient is much more common.
And we have one. We have a BID patient.
I haven't seen
Okay,
TCM.
standard wedges are used to do what?
It would be D, right?
I think so.
Delta.
Are you telling me D?
Yes.
Okay.
Me too. I don't know where the fucking problem is.
So they tilt the eyes of those lights so that you can get a different distribution. Supraclavicular lymph nodes are best treated using what? Anybody?
What's rotational technique?
Pardon?
Rotational? What is
That's
that?
an arc.
Okay, I figured that might be, but
Like C, right?
I don't think so because
Well,
I don't think it's C.
I think it's
nowadays it would be C.
I think it's
You
C.
do VMAT
Nowadays would be C, but this is not,
nowadays.
this is traditional, so.
Oh,
Um,
why is it?
if you have to just do
So that would be your tangents.
supraclavicular port.
Yeah.
Supraclavicular lymph
stuff.
nodes.
Yeah.
Are they close to the surface? Supraclavicular nodes. If you're treating a breast and you have to treat supraclavicular lymph nodes, and you're not doing IMRT, how would you treat the supraclav?
D.
I was thinking maybe D.
D.
C?
D. C in reality, but D for the exam.
No, it would be D for in reality normally. If you were just treating supraclavicular nodes, you would not do an arc, usually.
So like when
Are superficially
When I was
located
at
at the depth
the
of about
proton
3
center.
centimeters in the
in,
patient's normal body habitus. The field is typically anterior only. Half-beam technique will be used if matching to neck fields or to breast tangents.
so like on the true beam, they only did tangents. They didn't do superclav or anything like that. And they do arcs and stuff. So that's why I was
I
not
thought
convinced that
Yeah.
it was arc.
I was just convinced that it was rotational technique because
everyone's treated that.
You would,
that's what.
in all seriousness, guys, you would just do an AP field.
Okay.
It's much easier to do. Okay, here's another one. Patient is treated isocentrically with opposing fields on an 80 centimeter SAD 4MV linear accelerator. The original setup was for mid-plane treatment at a depth of 10. You recheck the SSD and note that the SSD for field number 1 is 70 and the SSD for field number 2 is 72. What is the new patient separation? You shouldn't even have to use a calculator on this one, guys, sorry. 80 centimeters SSD machine. 80 centimeters SAD machine, excuse me. Supposed to be a depth of 10, but one is a depth of, the SSD is 70 and one is 72. What is the new separation? B. Pardon? B. D?
Bravo.
B. B. Bravo. Thank you. We got this. 18. So 70 from 80 is 10. 72 from 80 is 8. So your separation is 18. Some of the old linear accelerators worked at 80 instead of 100. I think they throw that in just to confuse it. Misalignment of treatment fields may be the result of all of the following except.
C.
See again?
C is in Charlie.
See Charlie. Yep. You figure, okay. Washington Lever. The P-shaped blocks are placed to protect the what? Oh, yes. Somebody mumbled.
Kidneys. It was me, I
Okay.
mumbled.
We don't have to lie because you have mumble.
You were rapping earlier.
Okay, oh, just before we go into that further, let's just talk about that. So you have the kidney shaped blocks, right? Or the kidney blocks. How are they positioned? How do you make them? Can you use MLC? Why not?
What was that?
She can't, she's eating.
Yeah, you're right, however.
Good point, Christina, good point.
Okay,
Are we playing
So-
charades? Cause you can't have two collimators with your MLCs.
uh-huh.
'Cause
So
your
the collimators come in from the side, right?
Yeah, your MLCs.
So if you're shielding the kidneys,
Yeah.
you also shield the outside, which is something we don't want to do. So how do you get kidney shielding?
You gotta make them.
By how? How do you make them?
That stuff back there.
Sarah,
And it is called, that stuff back there?
Lead.
No,
Cerebin.
cerebin, which is a lead alloy. Remember, you use it for doing electrons, right? Same thing, just wider. Taller.
It's a BLT with cheese.
Mhm.
It's a BLT with cheese. All the
Yes,
things in the
right.
cerebin. Yeah. Do you get it?
Yeah.
Okay.
It would take me a minute to remember
Okay.
what
When
B. I don't remember.
When
the
making a
list.
mask using thermoplastic material, extra stretching is what?
I guess I don't really understand what the extra stretching means.
like when you take it out and you stretch it with your hand a little bit,
Oh, okay.
or is it?
Yeah.
It's like just to kind of like loosen it up a little before you put it over the face of the patient. I did
Okay.
one yesterday. I did 2 yesterday.
Well, I didn't know what they meant. Like,
I
because it
mean-
says
It could be, yeah, it could be that, or it could be just pushing it so that it doesn't get too tight, because it always gets tight
okay.
when it's dry.
That's
it
what I
cools,
assumed, but I wanted to
right?
make sure.
But I have a question because when they were talking about, like loosening it up a little for the patient so they're not like, whatever. It's like, they say you don't have to, but you can. Like it's not.
What, stretching it before you
Yeah,
put-
yeah. They say you can.
It's actually easier to put it on the patient.
Yeah, it is.
It's,
But it's not like a
no, you don't
definite.
have to.
Yeah, it's not like a
You don't
definite
have to.
thing. So I do. I
Yeah.
always do. But it's like
Yeah,
necessary for reforming the mask if the patient moves. No. Maybe I don't know.
I mean, if you have to reform the mask, you're just gonna start
You have
over
to
with
start
from
it.
scratch.
Yeah,
Yeah,
so I
so
feel
it's-
like that's out.
There are some people who
Maybe
say
But it's
you
supposed to be
can,
tight.
That's what I was thinking.
if the mask gets too tight or a patient's swelling or something like that,
You can tug on it a little bit.
supposedly, some people will take the mask, put it back in hot water and till it's get a little bit, and then reform it. What's wrong with that?
It's already been on the patient's
sanitary.
face. Yeah. It's
Yeah,
already-
it basically changes the whole shape, so you'd have to CT it
Restem, yeah.
and replan it.
Yeah.
So, yeah, so don't think
Alpha.
about that. So anyway,
I think A.
so what would you like me to,
We like A.
It has nothing to do with the skin dose. You don't want to reform it, so it's not B or C or
No.
D. And it doesn't.
It's not B
It's not
either.
B
I feel like
either.
Yeah.
I feel like it's not A because it says always.
Well, do you want the mask to be too tight ever?
Well, because you said they said it's not necessary.
It isn't necessary. Yeah,
So
I feel
it
like
would be always
depends.
recommended.
well, it
Yeah, but
depends.
recommended is
It
Not
different.
necessary.
It's
depends
different
on
from
the
necessary.
individual therapist, because some departments will say, yeah, you do that. If you look at some of the videos, they will show you them doing it.
I feel like if it said always necessary,
Yeah,
then
that
it
would be different.
incorrect. But it says always recommended.
So you still
I'm
okay?
fine.
I'm
I think
going
you want
with-
the mask to be tight.
I've-
Enough,
Yeah, but not too tight.
Not too tight.
You
so
want
where
it to
they
be
have no-
tight, but yeah, not too tight.
Yeah.
So I think A is the best answer
Okay.
personally.
Let's see.
Don't want to speak for everybody.
And here's another one
I speak for
Asia
everybody
to
and it's
send if it's not right, right?
Yeah, I'm gonna light them up. I'm gonna beat
Wow.
I don't agree with that.
I'm gonna beat them
Oh,
up.
here we go. So when making masks with thermoplastic, the therapist should take care to use correct positioning devices and heating temperatures so that, well, actually.
Well, and
yeah,
that's why I
listen to
wondered
the
what
answer here.
extra
Listen to the
stretching meant.
rationale. When making masks with
We don't get a
thermoplastics,
rationale in
the
the
therapist
Mm-mm.
should take care to use the correct positioning devices and heating temperatures so that extra stretching is avoided, therefore maintaining the effectiveness of the mask. Shrinking can be avoided if bath temperatures are verified and the mask is allowed to cool completely before removal.
Yeah.
That is correct. But I think they're thinking of something other than what we're thinking of.
Maybe
Yeah.
like they
That's-
they don't want you to pull it off their
Yeah,
face.
exactly.
Maybe that.
Yeah, yeah.
Who the fuck would do that?
So I think they're thinking of something else rather than what we were thinking of, because that just starts when we're pushing it, when it comes out of the oven or the water bath, we're just making sure that it's pliable in order to put it across. So I think we're still good. So you don't have to.
The keyword is the extra
Yeah.
stretching, I think. Because that's what threw me off and made me wonder, like, okay, why are they saying extra
Okay.
stretching?
Your patient began treatment with an enlarged cervical node. By the fourth week of treatment, the node has reduced greatly. A new contour needs to be taken. You may acquire a new external contour by using what?
Any?
Hmm?
Any of the above?
Any of the above. So D. That's correct. Okay, treatment machine accessories composed of dense metal should be kept at least how many centimeters away from the patient's skin surface?
C.
15. I remember that from
Yeah.
last week.
Suitable bolus material will include all of the following except
D.
D. And depending on what physicist you are working with, they would scream and yell at you for using this one. But some of them are okay with it. Okay. Patient is positioned supine with feet in towards the gantry, which means she's going in the feet first. The digital readout is 340 degrees. The proper beam projection would be called what? $340. Feet to gantry, so she's the opposite way from normal.
It would be left anterior oblique. Yeah.
Left anterior oblique. Okay, left the oblique. Yep. Gantry angle of 340. Good. Okay. Suitable for position for a patient needing total skin irradiation would be what?
A.
Total skin. A.
Yes.
Any advance on A? Everybody agree? Okay. Yep. Electronic portal imaging is a method by which the beam alignment is checked. When? When do we do portal imaging?
D?
D, delta? Do you agree?
Mm-hmm, mm-hmm.
Yep. Yep. Periodically thereafter. So how often should they be done?
Every
5 fractions.
Every 5 fractions.
But you know, I asked about that, and they said that if the prescription calls for a cone beam CT every day, that they don't even do those every 5th fraction. So I don't know whether it's a different, charging,
Yeah,
you know,
theoretically, you should do a portal image every 5 fractions, and that's how the physician gets paid for his weekly visit.
I don't know.
But they could now have decided that if they're doing it's going to be CT every day, that would work for them.
Maybe it's a different charging system now or something.
Maybe a different charging system, yeah.
I'll ask.
To avoid here we go. 15 cents, but which one is it, guys? 15, D?
Mm-hmm.
Okay. For a clinical whole brain without the use of a face mask, the inferior border will be at the mastoid process and where? And we've got 2. Whole brain. So the mastoid and then where?
2 and 3.
Yeah, 2 and 3.
Sorry?
2 and 3?
2 and 3? 2 and 3.
I wasn't paying attention
Positioning the patient in prone position means that the patient is
D.
lying on the abdomen.
That was a good question. I like questions like that.
Treatment fields should be labeled in the patient's record with reference to. And it would be nice to do 2 of these too, but
Yeah.
why? Somebody see why?
No, I said, yeah.
Oh,
I was
okay.
agreeing.
So, which one would you suggest?
Probably at least B. I was also thinking A, maybe. But I think B is the best. I feel like I have seen D too, but
You see gantry angle. Because it's usually like G whatever and then couch whatever.
well, I mean, like on the actual picture, like I've seen, like, you know,
Yeah.
but I don't know what I was looking at.
Anybody?
Personally, I like B the best. Well,
So which one?
well, are we talking images or in writing?
You're talking treatment fields, so if I said that I want to treat the pelvis and I wanted to treat angled areas, so maybe field here and a field here and a field here. What would they be labeled? So would you label
Because
them under
they would have
anatomical
numbers,
location,
field numbers.
or would you label them under beam direction? So beam direction would be something like LEO or LPO or something like that. Anatomical location might be pelvis.
I've definitely seen both, so it really just
Well, let's
depends.
just
I don't know
take
which
a
one would be
chance
the
here.
best, you know?
Let's do this and see what it says. So it's C, field numbers. Treatment field should be labeled by, look at this one, field labeled by anatomical location and beam direction.
What?
Yeah,
Okay, take a picture of that. Go send it to them.
Okay.
You gotta take
Field
the
should be
whole
labeled
thing.
by
That was insane.
Anatomical location and beam direction. Example, anterior right clavicle, posterior right
I took
clavicle.
2.
Huh?
I took 2.
So that to me is crazy. Do you agree?
Yes.
We've answered the correct one in that way. Yeah. Okay.
Treatment field should be labeled.
Okay. When a patient is receiving treatment through multiple ports, the patient should
B.
be.
Yep.
Bravo.
Yep.
Yep. An approach that addresses issues associated with inspiration and expiration is known as
D. Delta.
delta. Treatment of seminoma, an external testicular shield should be used for the remaining testicle. It's important since the TD55 for the testes is as low as
A.
treatment should be withheld if patient refuses, unexpected side effects are reported, or white blood cell count is 4,500.
That's pretty low, right? I would say all three. Hold on. I thought white blood cell
All
count was
three?
higher.
Anybody get any advance on all three? So you
No,
think 4,500
No.
is low?
no, it's not. It's normal. I thought it was higher, but it's normal. So 1 and 2. I mean, yeah. It should at least
So
be
what is-
paused if
What
there's
is
unexpected
the range
side.
for white cell count?
4,500 to
2?
11,000.
Yeah, depending on which lab you're using, some of them say that's 4,000 to 10,000, so, 4,500 is pretty normal. So 1 and 2 we decided, right?
Yes.
Which of the following technologies can be used to replace the need for wedge filters? B, Bravo? Main reason for tattooing, is to why are you tattooing?
I don't like any of these answers. I would say B is the best. Personally.
B.
We're thinking B is the best answer.
B?
Yeah.
Okay.
These are
The
just
jury
worded very
stands.
weird.
It's B,
Yeah, the way
Yeah.
they word these answers
Yeah.
are just a little.
is a permanent indicator for
Photo.
treatment fields, or for treated fields. Doesn't always mean that you're right on the field, it's just giving you an idea. If an error in dose delivery occurs, the therapist should go screaming
A.
from the room.
A.
Okay. Yeah. If 111 monitor units will deliver 100 centigrade for a given treatment, how many monitor units will deliver 250?
D as in dog.
D as in Delta?
Yeah.
277. Yeah. 277.5 is what I got.
So you round up.
Yes.
Yeah. And
Yeah.
it was 0.4. I just wanted to make sure you knew that since you're not 16.
Yeah, I know that.
Did you manage to do it, Adrian, with your cross multiplying or your direct proportion?
No, I was just waiting for somebody else to do it.
Which modalities are commonly used for IGRT?
Sure. Oh my god, do you guys know what IGRT stands for?
Do you?
Yeah, I'm kidding.
A.
Really?
I should
Use
just not take my
MRI for
answer.
cold beam CT?
I'm gonna say C.
Well, it's
Ultrasound?
Mm-hmm.
I mean, technically, yes, you could do
You
C.
could,
You could do ultrasound.
but I don't know. I've never seen it, so I was going with it.
Ultrasound? Ultrasound
Oh,
was
I
the one
guess
that they
for
they
image-
used to begin with.
That's true for image guided, but in Gainesville they have the MRI
MRI Linac.
treatment.
Yeah.
So
Yeah, that's
Yeah.
a new
it's
thing.
not wrong.
Actually, Philip just sent me some data on it.
Ooh. You send us
Because
data on it?
I emailed them and said that the manufacturers were ignoring me when I asked the data.
they're probably sick of you.
And
Is it up and running yet?
No,
no, it's not up yet.
magnets aren't in yet.
Sheesh.
So, what are we gonna say, ladies?
I don't know
So if it's
anymore.
old school,
I
we're going
think
C,
C.
because
Well, it's
Yeah.
not old school because some people are still using ultrasound.
C,
Yeah.
chart.
Let's see.
I think there are very few of the MRI out there
Yeah.
right now.
Yeah. I think
I
the
do
commonly.
think that's where it's going, but
Yeah.
Oh, yeah.
Commonly is not a
And
good word
they're
for MRI.
actually using MRI for planning now too, instead of CTs, so. Okay, a spine block was to be added at a dose of 45 gray. You discover that after a dose of 55 gray, the spine block has not yet been added. You should
40.
C.
Sorry,
C is in Charlie.
C.
Charlie? Oh, yeah. Now, how could that happen? So it says error should be documented. The error of this nature should be reported to the physician and the physicist so the actual dose of the cord can be verified and an alternative plan agreed upon to compensate for the error. So how do the therapists know to add spinal shielding at whatever dose they're gonna add spinal shielding to? How do the therapists know that? Obviously, most people know that you don't go above 4,500, but, you know, how does is there a notation in the chart,
It should be in the plan.
or does it come from the symmetry? Usually both. What they normally do is they'll do a plan up to whatever it is, 4,000 or 4,500, and then the symmetry will say, will make sure that the plan stops at 4,500 or 4,200 or 4,500 or whatever it happens to be. And then another plan will be done,
Yeah, that's
including
what I've seen.
the,
So like a reduction or something, so it takes
Yeah.
it off the.
so that shouldn't, I won't say it never happens, but it should not happen. The therapist may see a patient treated in the seated position because excuse me. I think we did this before, didn't we? Which one was it? I think it was
Let's
C.
see.
Have you ever seen that?
Yes,
Seated like completely upright?
we used to have a particular bed that was ordered for us from Varian. The top of the bed would come off, and we'd put it over in the corner of the machine. And then we had this, chair that would actually fit onto where the bed came off. And we could treat patients that way, so they'd sit in a chair. And it was, a homemade chair, but it matched the machine, and you had seat belts on it and everything, and the patient had a head base on here, they could lie back like that, and armrests so that they could keep their arms. And we used it for spinal cord compressions, where the patient couldn't lie down because of the pain. We also used it for SVC obstructions, where they couldn't lie down because they couldn't breathe. We used it maybe 3 or 4 times a year, but
At Proton, they have the eye line, which I had never heard of before going there.
sorry, which one?
At Proton, they have the eye line, which I had never heard of before going there. It's like to treat the eyeball.
Yeah. Yeah,
And you sit in a chair.
yeah, they sit in the chair.
But they don't treat anything other than the eye, right? That's
Well,
what
yeah.
I'm treating.
Yeah.
Yeah, because I was wondering the same thing with like with the spine, because our spine patients, we have a lot of them. And they are in so much pain when you
Yeah.
put them on that table and lie them in, and lay them down, and I was just wondering why they don't.
Well,
Even,
it's
even
so-
a board that would like sit them
Well,
up like,
you can use they have a breastboard there?
but they don't, yeah, but they don't use it. They're all flat. And I was trying to figure out, is that because they get better results doing that?
Well, you can see it better.
Okay. Because they're in
But
so
the
much pain.
ideal, well, actually, sometimes if you get the patient to lie prone, they're not in as much pain, but
They've
only
never
if you
done
can
that.
actually get them to
Yeah.
lie prone. There's a lot of patients that do that.
I feel like prone would be harder to reproduce. Just
No,
because-
it's actually
No.
easier. Well,
So
you,
because I would think their spine would be,
no, because the spine, what you're doing is, especially for a palliative patient, you're centering on the spine, you can actually feel the spinous processors. So you can see exactly where you're
but during
going.
treatment, wouldn't it raise and lower because of the breathing?
But you're
You're
raising
prone.
lower anyway because of the breathing,
Well,
yeah.
if you're on your back though, you're not, because your spine's laying down and you're,
But no, it's not as bad
yeah, I don't know.
because your
I
chest
always
is
wondered why they
compressed.
treat them like they do.
Yeah. It's actually easier. If the patient can do it, it's actually easier to treat a single
for those
field spine or
patients.
a double field spine prone. It really is. And actually,
They probably would appreciate it as a student if I would say, you know, I really think you ought to be treating.
no, well, you
I
know.
really
You could
think
ask
what you
why.
can, what you
I
can
do,
do.
I
Yeah.
do, but I, even sometimes when I ask why, they're kind of like, you know, this is what the disability had to do. And I'm
Yeah.
like, but why? Why?
Yeah.
Yeah.
You know, I mean, you could say, well, have you ever treated the spines prone?
Believe me, I
Because
ask a
we
lot
can
of questions.
We've discussed it in class type thing, you know,
Yeah.
blame on me if you want, I don't care.
That'd be a question maybe I could ask the dosimetrist.
Yeah.
Yeah.
And many, many years ago, we used to treat patients, believe it or not, this sounds totally stupid, but we used to treat patients who couldn't breathe very well prone on their chest. We used to treat them prone, and they actually could breathe better lying prone than they did lying flat on their backs.
Yeah, because I know, like, even like when you're sleeping, like laying
Yeah.
flat, like laying on your back is the
Yeah.
worst position to be
Yeah.
in because it's harder to breathe.
Yeah, so anyway. So for treatment of a soft, we'll stop after this one. For treatment of a soft tissue sarcoma on the calf of the leg, it would be reasonable to position the patient how? B?
D is dog.
So
Oh, D is
I
a
like
dog.
D, but what's lateral decubitus?
Decubitus.
Decubitus. Shit.
Again,
Just
Side.
shit.
legs
Okay.
sort of like so.
Okay. There's
This
too many
leg
words
straight,
for laying
the
on
other
your
leg that
side.
way.
Too many. I don't like.
So we've got prone with both legs together and immobilized. Yeah. No. Lateral decubitus with the affected leg
No.
elevated as high as
Sounds so
possible.
dumb.
Supine with both legs together and immobilized. No. Lateral decubitus with the affected leg moved away from the opposite leg and parallel to the couch. The calf.
But that positioning, the decubitus, is that easily reproducible?
When you're doing things like calves,
I guess
it's not, but it's.
as long as you get the calf positioned properly, that's really mainly what matters.
So what one would you like to do?
We like D.
D, delta?
Yep.
Okay. Yeah. Reasonable position among the ones listed says, the posterior lower leg would be to have the patient on their side with the affected leg isolated and parallel to the couch. So what you could do is you could have this leg and this leg that way.
Interesting.
Okay, so let's leave it as that. And everybody